We're going to move on to item number 2, SB 6, Extraordinary Session 2, Senator Monning, smoking in the workplace. If you don't mind, I think there's quite a few people that were here for the last bill. Unless they're going to stay, we'll wait till the room clears. Just a couple minutes. Okay, Senator, please proceed.
Thank you, Mr. Chair and members. Before I begin, I'd like to clarify that I will be amending the bill to restore the existing exemptions for retail tobacco shops and private lounges. I understand that those amendments will need to be taken in the next fiscal committee hearing, assuming the bill passes today. I'm here to present Senate Bill 6 in the second extraordinary session, which will close many of the existing loopholes in California's smoke-free workplace law. This landmark law was passed by the legislature in 1994 and provided the nation's first employee protections against exposure to secondhand smoke, the effects of which can lead to severe health conditions such as heart disease, stroke, lung cancer, and serious respiratory diseases. Now, more than 20 years later, many Californians are still forced to work in employment settings where they are subjected to secondhand smoke exposure due to a number of exemptions built into the original legislation. The California Department of Public Health estimates that these exemptions currently allow for 1 in 7 employees in California to work in a place of business where they could be exposed to secondhand smoke. It is unconscionable that we allow many Californians to enjoy safe and smoke-free workplace conditions while others are continuously exposed to harmful secondhand smoke. SBX 26 will remove many of the existing loopholes in California's smoke-free workplace law and prohibit smoking in owner-operated businesses, employee break rooms, warehouse facilities, hotel lobbies, meeting and banquet rooms, and businesses where there are fewer than 5 employees. I ask that you join me in ensuring that all Californians can work in an employment setting that is free from the dangers of secondhand smoke by voting aye on SB 26. And I'd like to thank you, Mr. Chair, members, for your time, and now turn over to witnesses in support of the legislation. Thank you.
Thank you. Please proceed.
Good afternoon. Callie Hampton on behalf of the American Heart and American Stroke Association in strong support of this bill to eliminate loopholes in current law. There's overwhelming scientific evidence that secondhand smoke is a direct cause of heart disease, the #1 killing of both men and women in California. U.S. Surgeon General's report in 2006 found that brief exposure to secondhand smoke can have an immediate adverse effect on one's cardiovascular system and health. Smoking costs the state of California $23 billion in both health costs and lost productivity. $3.5 billion out of this total is directly linked to Medi-Cal. Last year, 43,000 Californians lost their lives to tobacco-related disease and illness. Once the nation's leader in protecting workers from the deadly effects of secondhand smoke, California has fallen behind the national standards set by the CDC and is not considered a 100% smoke-free state. 26 other states, including the District of Columbia, already provide greater secondhand smoke protection in the workplace than California. As Senator Monning previously mentioned, 1 in 7 workers report being exposed to secondhand smoke, and of that, low-income workers, young adults, and Latinos are more likely to be exposed to secondhand smoke at work. Exposure to secondhand smoke should not be a condition of one's employment. It is time for California to catch up with the rest of the nation. Every Californian deserves to work in a healthy environment and should not have to make a choice between a good job or good health. We have the opportunity to do that here today, and I respectfully urge your aye vote on this measure. Thank you.
Mr. Chairman, Senators, Terry Brennan on behalf of SEIU, California. I can't imagine needing 3 minutes to talk about this bill. No one should have to, as a condition of their job, risk their health and risk their lives. Most of the people impacted by these loopholes are low-wage workers of color, and we urge your aye vote.
Mr. Chair, members, Sarah Flox, California Labor Federation. We supported the original law in 1994 to protect worker health and safety. And since then, California, once a leader, has fallen behind. I'd like to agree with my colleague from SEIU's comments. It is very easy for employers to exploit the owner-operator loophole, saying that some of their workers are actually vice presidents or co-owners, especially in low-wage service occupations in restaurants and in bars. We think it is very important to close this loophole to bring California once again to being a leader in protecting worker health and safety. Thank you.
Thank you. Anyone else in support? Please state your name and position.
Lindsay Freitas with the American Lung Association in California in strong support.
Kimberly Chen with the California Pan-Ethnic Health Network in support.
Jasmine Gordon with the California Black Health Network in support.
Jerry Jeffy, California Chronic Care Coalition in support.
Rebecca De La Rosa with the Latino Coalition for a Healthy California in strong support.
Lydia Bourne, American Academy of Pediatrics in support.
Alicia Sanchez representing the California Medical Association in support.
Judith Regal on behalf of the County Health Executives Association in support.
Gregory Kramer on behalf of Planned Parenthood Affiliates of California in support.
Kelly Beam on behalf of March of Dimes in support.
Megan Allred on behalf of the California Dental Association in support.
Sawai Team on behalf of Health Access California in support.
Fred Notwer on behalf of the Association of Northern California Oncologists and the Medical Oncology Association of Southern California in support. Thank you.
Alexis Fernandez on behalf of the First Five Association in support.
Tim Gibbs, American Cancer Society Cancer Action Network in support.
Sean South on behalf of the California Primary Care Association in support.
Dr. Donald Lyman with the California Academy of Preventive Medicine in support.
Thank you. Any opposition to the measure? Do you have any questions or comments from any of the members?
Yes.
Senator Hall.
Mr. Chair, thank you. Does this also include gaming clubs?
So some of the gaming clubs, if they're part of an Indian compact, they're not affected by this because they're sovereign nations and they develop their own rules and regulations.
And what about the card clubs?
Those, I believe, are already subject to, that's not a new addition, they're already under the prohibition.
Very good, thank you.
Mm-hmm.
Seeing no other questions or comments from any of the members, is there a motion? Motion by Senator Pan. Would you like to close?
Yeah, just briefly, glad to be part of this suite of bills to build on the health foundation that California has led the nation. The time is appropriate to move forward. There's minimal costs associated with this legislation and maximal health benefits. I urge your aye vote.
Thank you. This is item number 2, SB 6, second extraordinary session. Chair's recommending support to pass to appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Morrell. Anderson. Bell. Bell, aye. Hall. Hall, aye. Leno. Leno, aye. McGuire. McGuire, aye. Mitchell. Monning.
Aye.
Monning, aye. Morlock. Morlock, no. Nielsen. Pan. Pan, aye. Wolk. Wolk, aye.
Current vote count is 8-1. Enough to get out, but we're going to still keep that bill on call. We're going to move to item number 5, SB 9, second extraordinary session. McGuire. Local taxes, authorization, cigarettes, and tobacco products.
Good afternoon, Mr. Chair. Thank you so much for allowing me this opportunity, and good afternoon, members. Tobacco use is the single most preventable cause of death and disease in California and throughout this great country. Nationally, one out of every 5 deaths is attributable to smoking. Here in the Golden State, that adds up to nearly 40,000 residents every year passing away from smoking-related diseases. There are many different ways Californians can suppress this deadly habit, but time and time again, according to all of the leading experts, price point for a pack of cigarettes, chewing tobacco, and other tobacco-related products is widely recognized as the most effective way to reduce smoking, especially among young people. In fact, according to the American Cancer Society and multiple studies that they have produced, for every 10% increase in the price of cigarettes, there is a 4% reduction in overall cigarette consumption and a 6.5% reduction in youth consumption. It's clear price point moves the needle towards a healthier California. It has been 16 years since California last raised its tobacco tax. And during that time, we've seen our state's costs of providing health care for those inflicted with a tobacco-related disease increase significantly. According to the Center for Disease Control, smoking-related diseases cost California nearly $13.29 billion in medical expenses every year, and the cost of lost worker productivity to tobacco use is $10.35 billion annually. An average California's family tax burden from smoking-caused government expenditures is $745 per household. And paying for these health costs is a form of subsidized medicine for tobacco users. The fact is this: California has one of the lowest tobacco taxes in the nation, currently ranking 35th in the nation with a tax of 87 cents per pack. The national average state tobacco tax is $1.60 per pack. New York is the highest at $4.35 per pack. Even Texas has a higher tobacco tax at $1.41. And if you go to Montana, you're spending $1.70. While disease caused by tobacco has tremendous impacts on the lives of families and communities across the state, it also has significant financial implications for state and local budgets. Treatment of cancer, heart disease, strokes, lung disease, diabetes, and other diseases related to tobacco continues to impose a significant burden on California's overstressed healthcare system. Moreover, smoking disproportionately affects low-income communities in California. For example, African-American men and women have the highest adult smoking rates in the state, between 17 and 23%. The lesbian, gay, bisexual, and transgender community smokes at the highest rate, 27.4%. Additionally, pregnant women still smoke at a rate over 8% in California. Smoking prevalence is higher among those who are younger, have lower incomes, and are either on Medicaid or have no health insurance. All of this leads to additional local government financial obligations and increased challenges for those segments of our population that are most vulnerable. Nationally, over 600 local jurisdictions have their own cigarette and/or tobacco taxes. Unfortunately, here in California, no local cities or counties have a health-related tax related to tobacco products because it's currently prohibited by law. As a footnote, these 600 non-California local jurisdictions across the country generate more than $430 million in annual revenue that directly benefits smoking rate suppression programming, especially among youth, and these dollars are invested at the local level in services that focuses on decreasing smoking-caused diseases and death. I gotta say, and I think a lot of us are, big believers in local control. And it makes sense to allow counties, who in many cases throughout California are the ones who are delivering health care services through hospital and community health center contracts, to invest in local smoking suppression programming that will help Californians kick this deadly habit, or, as what we see with every study, or stop kids from starting using tobacco in the first place. This bill is simple. It allows counties to place a local tax initiative onto their ballot and to let voters decide to impose a tobacco-related tax, or not. By raising local cigarette and tobacco taxes, counties would have the resources to implement tobacco prevention and health programs and target those dollars in the neighborhoods of greatest needs. We should let those decisions be up to those who are on the county boards of supervisors who know their neighborhoods. Local control of tobacco taxes is a critical tool in allowing communities to set public health priorities that can better meet the needs of its residents. Those folks on the local level know what works best because they're on the ground doing the work day in and day out. Finally, Mr. Chair, tobacco tax revenues can help California counties take advantage of new federal matching funds available under the Affordable Care Act to improve the health system on which we all rely. We are currently working with this committee, and I want to say thank you so much to the chair and to the amazing committee staff and the Board of Equalization to work out all the technical details. I will say, while we are studying several options, one option that is not being studied is a local retail tax. We're going to continue working with the committee and our incredible partners in the Assembly and the Coalition to iron out the details of this important initiative over the next 2 weeks. Again, Mr. Chair, thank you for allowing me this opportunity.
Thank you. Anyone like to speak in support of the measure? Please proceed.
I'm Lindsay Freitas with the American Lung Association in California, and we're here in strong support of the bill. This bill will prevent kids from smoking, improve public health, and generate local revenue. Nearly 40,000 Californians die each year from tobacco-related illness. And smoking, as the senator mentioned, is the leading cause of preventable death in the United States, killing more people than alcohol, AIDS, car accidents, illegal drugs, murders, and suicides combined. The Surgeon General projects that without further action, 5.6 million youth aged 0 to 17 alive today will die prematurely from tobacco use. And tobacco taxes, whether at the state, federal, or local level, have been proven to be one of the most effective ways to reduce smoking and improve public health outcomes, particularly in low-income and minority communities. This is because for every 10% increase in the price of cigarettes, there's a 4% reduction in overall cigarette consumption and a 6.5% reduction in youth consumption. In California, we currently have over 21,000 youth who start smoking every year. And by allowing counties to tax tobacco, they can take a step to ensure that some of those kids never start smoking and lower that number. Not only will this bill allow counties the opportunity to save lives, but also money. This bill will give counties a chance to pass a tax that will ultimately save millions of dollars. Overall, tobacco-related disease cost Medi-Cal $3.5 billion a year in direct expenses. And tobacco use inflicts a terrible financial toll on our state as a whole. It costs California roughly $13.2 billion in total medical expenses each year and $10.3 billion in lost productivity and wages. On average, a California family's tax burden from smoking-caused government expenditures is $745 per household. And on a county-to-county basis, that cost varies from $374 per resident in Orange County all the way up to over $1,000 per resident in Lake County. And the total costs vary from around $300,000 total in Alpine County to a total of $4.4 billion to the County of Los Angeles yearly. All of these associated costs will decrease as the number of people smoking decreases, and allowing counties to take this effective step to improve health and address some of these costs associated with tobacco will benefit the state as a whole. For these reasons, I respectfully request your support of this bill and give counties one more tool in their arsenal to fight back against tobacco.
Good afternoon. Tim Gibbs with the American Cancer Society Cancer Action Network, and we support this legislation because we think that local communities should be given a choice when it comes to going beyond state law to protect their citizens from the deadly effects of tobacco use. Allowing counties the ability to give voters a choice on whether a higher tax makes sense for their community is the essence of local control. One of the most pernicious tactics that the tobacco companies use in order to stymie legislation and ensure that no policies pass that result in fewer people smoking is to preempt local governments from passing tobacco control legislation. Their modus operandi is to pass a weak law at the state level where they yield more power and then prevent the locals from improving on that weak policy. For the most part, California has a long history of resisting the tobacco companies' attempts to preempt local efforts to reduce smoking. The reason we were able to pass the nation's first smoke-free workplace law was because local efforts made that happen. Local communities had the ability to decide for themselves whether or not they wanted to protect workers from the harmful effects of secondhand smoke. Across the state, communities acted, which eventually led to the state enacting a minimum standard for smoke-free workplaces. Many communities have chosen to go beyond the minimum standard that the state has set. We've also resisted local preemption for local licensing ordinances, and those licensing ordinances have given law enforcement the ability to enforce youth access laws. Unfortunately, the one area where the tobacco companies have been successful in preventing local communities from protecting their citizens has been in the realm of tobacco taxes. Nearly 50 years ago, California decided not to allow counties the ability to levy tobacco taxes. With more than 600 jurisdictions across the country that can levy their own tobacco taxes, we want to give our 58 counties the ability to decide for themselves. This is not a vote about raising tobacco taxes. This is a vote about establishing local control and stopping the tobacco companies from preempting counties from reducing smoking. We hope that you agree that counties deserve to decide for themselves, and we respectfully ask for your aye vote.
Kimberly Chen with the California Pan-Ethnic Health Network in support. The tobacco industry targets specifically communities of color. This provides a tool for the locals to push back against those tactics. Thank you.
Thank you. Anyone else in support? State your name and position.
Jasmine Gordon on behalf of the California Black Health Network in strong support.
So Wyatt Sume on behalf of Health Access California, we are in support.
Alicia Sanchez representing the California Medical Association, and our colleague from the California Society of Addiction Medicine had to step out of the room but wanted their support recorded as well.
Karen Lang on behalf of the Solano County Board of Supervisors and the Sonoma County Board of Supervisors in support.
City Bourne representing American Academy of Pediatrics in support.
And Jerry Jeffy representing California Chronic Care Coalition in support.
Gregory Kramer on behalf of Planned Parenthood Affiliates of California in support.
Megan Allred on behalf of the California Dental Association in support.
Kula Koenig with the American Heart Association, American Stroke Association, proud co-sponsors of this bill.
Kelly Beam on behalf of March of Dimes in support.
Terry Brennan on behalf of SEIU California in support.
Fred Nowhere on behalf of Organized Oncology in support.
Alexis Fernandez on behalf of the First Five Association in support.
Dr. Donald Lyman, California Academy of Preventive Medicine in support.
Jesus again, I support this bill, but honestly, vaping's going to help a lot better than taxation will. As a teacher, I just know.
Any opposition?
Mr. Chairman, members, Dennis Loper representing the California Distributors Association. We are the taxpayer. As this bill says, for the privilege of distributing tobacco products, you will be taxed. 50 years ago, it's correct. In 1967, the law was changed. And the law was changed because during the time before that, from 59 to 67, local entities had the right to tax. And frankly, particularly in Los Angeles County, it was chaos. There was more bootlegging and problems with smuggling at that time than any other time in the history of California tobacco taxation. Again, it's been tried and tested, and it didn't work. We will have jurisdictions all over the state that will have to have different rates and taxes. Retailers will across the street from each other have different rates and taxes depending whether they're in the incorporated part of the county or unincorporated part of the county. It doesn't make sense. It makes sense for taxation purposes that they be held at statewide, and for those reasons we oppose.
Thank you. Anyone else in opposition? Can we turn your mic on? Can we get our mic on?
For the California Chamber of Commerce in opposition.
Thank you.
Good afternoon, members.
Dane Hutchings with the California Grocers Association in opposition.
Peter Blocker, California Taxpayer Association, opposed.
Thank you. Anyone else in opposition? Any questions from any of the members? Senator Morlock?
Senator McGuire, I'm sort of baffled because we've seen this before. In the mid-90s, a young man by the name of Michael Moore became the Attorney General for the state of Mississippi, and he sued the tobacco companies, and it resulted in the National Tobacco Settlement, and it gave most of the 50 states a revenue stream from the sale of tobacco, and it actually gave a couple of states, including California, it gave all 58 counties a portion of that revenue. So in Orange County, we fought over how to use that money, cessation or for debt retirement or for coalition of community clinics. We built a plan on what to do with that funding. I think the state of California decided to take the money and securitize it and pay for one of Gray Davis's annual budget deficits. So we didn't do anything at the state level with that money, which made Mr. Moore a little upset. He was portrayed by Russell Crowe in the movie The Insider, which was all about the National Tobacco Settlement. So I'm just wondering, have you done any analysis of what the 58 counties are doing with the National Tobacco Settlement revenues they're getting already to deal with cessation and health and all the rest? Because this would be an add-on.
Well, so what we currently have is an 87 cents per pack distributor tax here in California. As far as the tobacco tax settlement, it was dependent on each county on how they want to be able to spend those dollars, as you know. And I was also a member of the County Board of Supervisors. But what I can tell you is this. It costs the average household here in California with unreimbursed care about $745 per year for tobacco-related disease in California. And this is with the tobacco settlement as well as the 87 cents per pack. We're the largest state in the union with one of the lowest per pack distributor packs in the union as well. And what I can tell you is we have healthcare costs in the billions, and why not give voters a choice? This is simply a choice. I'm not going to stand in front of you here today to tell you what's best for Orange County or Modoc County, but I am going to stand out and say, let's give voters a choice. And if they want to keep those dollars local to be able to fight those diseases that are in their county, so be it. And it will help local health centers as well as local hospitals as well. So that's where I'm focused. I can't comment on how Governor Davis spent the dollars, but what I can say is I do think that we owe it to our counties to give them a choice. And by the way, they're on the front lines of this issue. They are the deliverer of state services as well as healthcare.
So what about the rule of unintended consequences, where if one county votes to increase the tax on cigarettes and you live close to the border like I do, then you could drive to LA County and purchase in bulk there? Or what would there be? I mean, you're trying to reduce the use of tobacco, so you're raising the tax, trying to reduce it. So you're not, how do you, at the end of the day, how do you net money to do any cessation?
Well, it's going to ultimately be up to the county. So I know that Orange County is very much pro-tax. What I would hope is that the Orange County Board of Supervisors would be able to advance tobacco-related distributor tax that could be implemented in the county to ensure that it doesn't become an island and a destination for tobacco users. So I would hope that going to be able to work together as regional governments to be able to advance this. It is work, by the way. We're not reinventing the wheel. We are looking at 600 other local jurisdictions across this union that have developed successful systems. I live in a community that has advanced 21 or over for tobacco products. And it is important that our local governments are able to take a stand. And by the way, local governments oftentimes are able to move much quicker than what state and federal governments are able to do. So I actually believe we're going to see more change on a local level at a quicker clip than we will here at the state or on the federal government level as well.
Thank you. Thank you, Mr. Chair.
Thank you. Senator Bell.
Just, he's talking about history. The tobacco settlement was a great victory that was led by the County of Santa Clara County Council Ann Ravel and the County of San Francisco's great Louise Rennie. And the settlement was awarded to the counties and the cities. And in our county, we decided to be the first county to insure all children. So the money was spent to insure, or the majority of the money was spent to insure all children in Santa Clara County. We started our Children's Healthcare Initiative. And I think what happened was after that, 26 counties did the similar thing with the tobacco settlement. Without the tobacco settlement, we would have had the Children's Healthcare Initiatives because that money was used to fund insurance for all kids. And so it was a great victory, and I'm quite proud of that, that effort that we did in 2001. Thank you.
Thank you. Any other questions? Yes, Senator Leno.
Thank you, Mr. Chair. Senator McGuire, I think that Senator Morlock's question is a thoughtful one, and there's actually a term for it. I came to learn of it when I authored a bill, which took about 6 years to get signed into law, which allows San Francisco to be able, as a county, to be able to increase its own vehicle license fee up to the original $2, that 2%, excuse me, that was the original state VLF until the late 1990s. And there was concern, would people register their vehicles outside of the county and try and game the system? And so the term is called leakage. Would there be leakage? But as Senator McGuire points out, this already exists in hundreds and hundreds of cities and counties around the country. And if leakage were such a serious problem, I would imagine that they would be reversing them. But do you know, I was going to ask you, do you know how long, because I know that New York City and Chicago have some of the highest local, do you know when their states gave them their authority, or they just had it as we used to have?
I don't have it at my fingertips at the moment, but I will definitely get back to you on that in regards to.
But, so it's a reasonable concern, but I think we don't have to conjecture as to what happens. We know what happens, and it's just not that serious. And in fact, as the analysis points out, San Francisco has a 20-cent per pack cigarette litter abatement fee, and that raises some millions of dollars each year for the city and county of San Francisco to use for litter abatement that comes from cigarettes. And I don't know that we've experienced any leakage over that 20 cents per pack. And just to final my comments, I think the strongest argument for this, aside from local control, which I think is a significant one, is that the healthcare costs are borne at the local level. And so for us, the state, to tell locals, you let your own voters decide how to raise money to deal with their own health issues, just seems a bit imperious. And we often talk about, why is California dictating to locals? Well, here's an opportunity for us to say, let my people go, local control, voter determination.
Absolutely. Thank you.
I move the bill.
Thank you, so much, Senator. Seeing no other questions, comments, we have a motion by Senator Leno. Would you like to close?
Thank you so much. And Senator Leno does bring up a really good point in regards to San Francisco. This bill would also respect, and San Francisco is the only city and county, so it would respect the 20 cents. So thank you so much, Mr. Hall. Hot day. And I'll just end it with this. Today's decision is about choice, the choice to move the needle in neighborhoods, and would greatly appreciate your support. Thank you so much, Mr. Chair.
Thank you. The chair is recommending an aye.
Mr. Chair.
Yes.
I'm sorry, may I ask one more question?
I will allow it, yes.
As long as Mr. Hall is okay. Hot day. Okay, there we go. Hot day. All right.
Thank you. Just for my clarification.
Yes, sir.
Is this something that the Board of Supervisors would vote on and approve themselves, or are they voting to put it on a ballot so the voters would approve the tax? Okay.
They would need to vote to put it onto a ballot, and then the voters would ultimately decide. This does not give.
Where's that in the bill?
Let me grab it.
Yeah. So it's just inferred that it would. Yeah. Okay.
Oh, there we go.
Great. Then I've got that. Thank you. Thank you very much.
Thank you.
Appreciate it, Mr. Chair. Thank you, Senator McGuire.
Yeah, absolutely. And just to clarify, under existing law, it's my understanding that local governments have to be able to put that forward. So this would not allow Board of Supervisors to be able to advance it themselves. It would allow them to put it onto the ballot and ultimately have the voters decide.
So that means
it was unclear in my.
That means you're going to vote for it now, right?
You never know. Why don't you just call the roll?
Hey, there we go.
Okay, we're at item number 5, SB 9, Special Session 2. Leno moved the bill. Call the members.
Hernandez.
Aye.
Hernandez, aye. Morel. No. Morel, no. Anderson. Bell. Bell, aye. Hall. Hall, aye. Leno. Leno, aye. McGuire.
Aye.
McGuire, aye. Mitchell. Monning. Aye. Monning, aye. Morlock. Nielsen. Nielsen, no. Pan.
Aye.
Pan, aye. Wolk. Wolk, aye.
Thank you.
Currently has 8, enough to get out. We have a member, I believe, or 2 members absent. We'll put that bill on call.